My name is Dr. Scott. I'm in Zanesville, Ohio, practice of podiatry, specializing in foot and ankle. My education experience is I started out at S.U.N.Y University in New York State with an undergraduate degree in biochemistry and genetic engineering. From there, I moved on to Cleveland, Ohio, where I did my graduate degree in podiatric medicine and finished my residency in St. Louis, Missouri. After I left my undergraduate degree, I went to work for a chemical company out of Chicago, Illinois. I worked for them for 3 or 4 years in the field with steel mills and water treatment plants and that type of thing. From there, I decided that wasn't what I wanted to do. Went back to school, decided I wanted to go to medicine, went back to school, finished my degree, like I said, in St. Louis. And from there, I came directly to Zanesville. I was recruited out of residency to Zanesville, and I've been here in the practice of podiatry for the last 22 years. I chose Zanesville because initially for 2 reasons. The first reason being that it was similar to my hometown, similar to the size of my hometown, and I felt comfortable here. The second reason is that I had a lot of opportunity here to grow as a podiatric physician. The orthopedic community accepted us well. I got along with a lot of the physicians right off the bat from my first meeting here with them. We all went out to dinner, we had a great time, and they remain my friends to this day. So it was a good environment to start with. That's why I'm still here. I realized I wanted to become a doctor for one simple reason. I was very involved in my grandmother's life. She was probably one of the closest people to me. She had diabetes. I got to know the podiatric physician that worked on her. He saved her leg. He was able to get her back to her life, moving again, where the other doctors weren't paying attention to her. I got to know him, and he said, hey, you've got the background. Why don't you go on to medical school? Why don't you go on podiatry school and, move into surgery? It's a very simple answer, and I relate it back to my grandmother. She's the one that got me started on this path. What I would want my patients to know about me is when you walk through the door, you're going to get my undivided attention for as long as you need for you to understand what your problem is, what you need to do to get better, and we can move forward together with a treatment plan. I'm not going to beat around the bush. You're going to know exactly what needs to be done. Questions that I think are important for my patients to answer are, what are their level of activities, what they feel like their problem is, and what their expected outcomes are. A lot of times, I have to look at you and I have to guess a little bit. I don't want to guess. I want you to tell me exactly what the problem is and what you expect to do in the future. I need to know that if you expect to be a marathon runner, then that's how we have to approach your care. Procedures that I offer through Genesis HealthCare system deal exclusively with the foot and ankle, all foot and ankle surgeries, including total ankle replacement, rear foot reconstruction, bunion surgery, fusions. We do a lot of diabetic foot care. We do a lot of diabetic wound care and limb salvage. Medicine has improved specifically in the area of podiatry in 2 ways. One, the technology regarding total ankle replacements is vastly improved from what it was before. The second is in the area of vascular surgery, they're able to do things so much better to provide us the opportunity to save people's limbs that we just could not before. There's been more than one instance where patients have come into my life and become part of my life, and we've moved through their disease process together, as with all physicians. I'm not alone in that. But I've had the opportunity on several occasions, and usually with younger patients, usually with the kids. I've been in town long enough now, and I've worked at this long enough to start with these children when they're, 4 or 5 years old. And then I continue their care now, and I have several under my care that are 23 years old, 27 years old. And growing up with them, watching them grow up, interacting with the families, but specifically, I was able to, on a couple different occasions, these children were unable to participate in sports, they were unable to participate in certain activities, and the family has come back and they've thanked me immensely. They've had special gifts made for me, and it just really is a true, that's what's rewarding about it. And I'm still in contact with these families, and I watch the kids go off to college, and then when they come back from college, they come back and see me. So it's a good thing.